Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
And they also have fewer blood tests and other tests to identify heart disease. And so they've come up with an idea that almost many women get mammograms. And the mammograms generally, they just look at the breast tissue. But they recognize that more people die of heart disease, especially women, than they die of breast cancer. And there's really no good screening test for heart disease, but there's a screening test for breast cancer. And so since so many millions of women get mammograms, they identified a new technique in which they have artificial intelligence that looks at the mammogram and looks at the arteries and is able to identify heart disease just by looking at the mammograms. So that's a new way of detecting heart disease earlier for women, since women are more likely to have it and have it more seriously than men, which is a new idea. It's something that has not been released as an official way of doing it, but AI has they have a program that they've already set up so that when you get your mammogram, if you're interested, they can have AI look for the calcifications in your coronary arteries. So I thought that was interesting because we've been talking the last couple of weeks about how young women, women under 50, have more high blood pressure and die from heart disease more than men. Any thoughts about that? How many of you women would want to have your mammogram evaluated to see if your coronary arteries are any good? Any thoughts about that?
Is there pain?
What'd you say?
Will there be any pain?
No. The mammogram is where you have and as you mentioned before, no woman that I know of likes having mammograms anyway.
Right. I would say
But,
one-stop shop. You know, if you can do 2 for 1, I'm for it.
And no pain.
And no hurting, no more than what it is. No more discomfort.
Absolutely.
Yeah.
I'm for it also. Sounds great.
And I'm sure it came about from DEI.
oh, you still talking that stuff? Why? I mean, it could just because people want to do the right thing.
Sometimes we have to nudge men. You know what I mean? We got.
No, I do not.
Yes,
No, I do
you
do. But anyway, so nobody's opposed to it, huh?
Not at all. Very important. Very, very important.
Okay.
Dr. Callender, my doctor has me doing this heart thing, EKG or whatever it is, once a year, or cardiogram. Is that part of it, or it's just to see how my heart is going once a year?
I didn't hear what you said.
Oh, my doctor has me coming in once a year to check on my heart, an EKG or something he does. Some specialists come in and take, does an exam of just the heart, of how it's
No. That's an important test to look at your heart. But this is a mammogram, which was intended just to look at your breast, but they can also look at your coronary arteries at the same time if they use the AI to look at the mammogram. But which is separate from having screening tests for heart disease, which we don't really have a screening test for heart disease in younger women, which is part of the problem. Catherine?
I'm gonna see if they do that. Ask me about that when I go in
To
next
adults
week
over
for
60,
mine.
your Social Security increase will not be automatically sent to you.
Carol, yeah. They haven't started doing it yet, but this is just an alarm to let you know that it's in the works. I don't know if
Okay.
anybody has started doing it in DC yet or Maryland, but it's something that is going to be available shortly. I'm not sure if it's available here yet. Sylvia?
Yes, good morning, everybody. I was just wondering now, is it a new machine that they have to get, or are they using
No. Nothing new. It's
okay.
just that AI is the application of artificial intelligence
Oh,
that will they have a program that allows them to look at the mammogram and look at the blood vessels and identify if your coronary arteries are calcified. So the test is not new, but the application of AI to the mammography is new.
oh, okay. Thank you.
Dr. Perez?
Over the last couple of years, I've been going to Community Radiology and Associates, and they have had an enhanced mammogram for an additional cost. And they include that they said that the studies will be used for future and further in-depth investigation, which I'm assuming lines up with this article. But that is also for increased costs, and which can be a significant limitation. And we have to be advocates for all of our sisters.
Well, I think the question is if this will allow more women to be diagnosed with heart disease and prevent them from dying, and if the cost is not significant, then it would be a worthwhile investment.
Yeah.
But
Uh,
I'm saying my issue is that just with AI, already the information that is being captured is skewed based on economics.
whether it's
Because only, because
but that
only, go ahead.
I was going to say that's not the issue. Is not that there are adversities associated with it. It's just the idea that this can be a way in which women can have an earlier diagnosis of heart disease and prevent them from dying from heart disease. There are associated limitations, but this is just to be aware. And if somebody was interested and they could get that done, it's not something that is obligatory. It's something that if you wanted to have it done, uh, the utilization of AI for that purpose is now becoming available. It's brand new, so it's not may not be on the market yet, but it's something that you might keep in mind. Catherine?
I was just gonna say, it sounds like if it's an application, it should be able to be applied to the current exam that you already had, as opposed to that enhanced exam that they're doing now.
That's the way it's intended, that it would the exam would already be done, but you just apply AI to it and and look at the coronary arteries, which they hadn't done before because they're just looking at the breast. Uh, let's see, Carol, and then Janice.
Okay, this is directed to Dr. Perez. I'm getting my mammogram on Friday, and that enhancement that you were talking about costs $40 more. And I was trying to figure out, why do I need that enhancement, or what does it actually do? They say enhancement, and what is it enhancing?
I can't answer that question. I guess the radiologist would have to answer because there's different types of mammograms, there's ultrasounds and MRIs and other things. So I don't know what that enhancement is, but it's not uh, related to what we're talking about here.
Oh, I know, but I was just gonna ask Dr. Perez, does she know since she pays for that $40?
What they say is that it's going to be looked at in greater detail, taking into account my age and previous mammograms. That's what they advertise. Whether they're just collecting my money or not, I don't know. But I'm assuming that they're going to take a better look for my $40.
That's what I thought too, and I was trying to figure out if you're gonna look at it, just look at it. Why not I pay $40 where you look at it the second time? But I don't know. Did you?
Well,
I
you can
know you
ask
paid
them.
the $40, but I don't know. I'm trying to elect whether.
Okay, I'm gonna send you $40.
No, why don't you ask them when you go get your test? Ask them specifically why. Uh,
Okay.
uh, who's next? Betty or
Well,
Betty, are you next?
Yes. Good morning, everyone. I'm one of the ones that took the test like Dr. Perez, and just like she said, they said it was just an enhanced version of your mammogram. But when I did it, they claimed they saw some tissue. You know, I mentioned it several months ago that they claimed they saw some tissue, and I had to go get a biopsy and all of this, and it ended up that they thought maybe I had breast cancer, but I did not. And so it took me through a whole lot of other changes. They even said they wanted to put something in my breast that they could detect mammograms without, detect breast cancer. So after giving them my $40 and going through all of that, even having to ended up going to a specialist, a physician that does breast cancer. Nothing came of it. So I just felt like I had kind of wasted my time, maybe, and my money. But
Okay.
that's all they said
Darryl?
was enhancement. And they
Okay.
took me through all those changes.
Thank you for sharing. Darryl, you had a comment?
Yeah, I just did a search on the difference between enhanced mammogram and standard mammogram, and it says that the enhanced is a contrast enhanced mammogram using a specialized diagnostic test using an iodine-based dye and X-rays to highlight blood flow, and it makes it significantly more sensitive for detecting small tumors than standard mammography. And it offers superior accuracy, especially in dense breast tissue. Black women they have a tendency to have more dense breast tissue than other ethnic groups, and so considering that with dense breast tissue, a standard mammograms are more likely to miss small tumors. I think it's a good idea for Black women to have the enhanced mammogram. It does involve an IV injection for the iodine contrast before the standard mammography, but Carol, I'll send you $40.
yeah.
Okay, Janice, you're next. Thanks for sharing, Darryl. Thanks for
Yeah.
sharing.
I was supporting Lucille. I go to community radiology as well, and I've paid the $40. And it's just a more in-depth look. Now, as far as injections and all of that, no, it's the same mammogram. And I had a call back, or they took a second look, but it turned out to be calcification. I have dense breasts. So for me, if they weren't going to do anything invasive and it was a more in-depth look, the $40 was worth the money.
Okay, Lucy?
And I want to say that even though you had to go and be seen by other physicians, and there were other steps that gives me some confidence that my $40 wasn't just sucked up,
Mhm.
and that someone actually took a deeper look. And recently, I have some beloved people in my life wish they had an enhanced look earlier. And so, though it was several steps, I'm glad it came to a not necessary for you, but it could have been different.
Mhm.
And I think it's worth it.
Yeah.
Thank you for sharing. Carol, you had another comment?
Yes. Since my breasts are not dense, that means I really don't need it. Those are people with dense breasts. I wasn't blessed.
Do it
We're
anyway.
sending you the
Do it
$40.
anyway. Daryl's going to
Just
give you
go
No,
ahead
no,
and get
but
it done.
you're saying your breasts are not dense. The mammography is not saying that your breasts are not dense. Are they?
Oh,
Yeah, so yeah.
Daryl, send her the money.
That's your
Do it.
statement. That doesn't mean that it's accurate. Darryl, you had another comment?
Yeah, dense breast has nothing to do with breast size.
Mhm.
Right.
Thank you. That's what I was going to say.
Yeah.
Okay. Did you have anything else to add, Betty, or is that
No, that's the same thing I was going to say. The size has
right?
nothing to do with density.
Right. Okay. All right. So that's so what we're talking about with the calcifications of the coronary arteries is completely separate from what you're talking about with the enhancement. But it's a new development that may come to pass in the next few months. That the opportunity to diagnose heart disease earlier for women may actually come to pass because, as we discussed over the last couple of weeks, that women uh, have more heart disease, they have more severe heart disease, they have higher mortality with heart disease, and they actually have more problems with hypertension than men. So that it's something down the road that may be of value for women, particularly women under 50. The second article that was of great interest was the case for an early colonoscopy. Since uh, uh, Chadwick Boseman and several other celebrities have died under 50 with colon cancer, it is becoming evident that colon cancer is occurring more often for people under 50. And so the age at which you get a colonoscopy, which used to be 50 and is now 45, could even be younger because we have so many people who are under 45 who actually are dying of colon cancer. And so for that reason, there's a question as to when should you have your colonoscopy? And there are certain diseases for which you need to get colonoscopy under 40, under 45. And there, if you have a irritable bowel disease is one indication. Another indication is if you have a Lynch syndrome, which is where you have a genetic predisposition to cancer of the colon. And another is if you have in your family people who are younger than 50 who develop colon cancer, or if they develop adenomas in the colon, or if you at any age have uh, change in bowel habits, rectal bleeding, abdominal pain that persists longer than a month, then you should see your doctor and consider getting an earlier colonoscopy. This is something that is becoming more evident that younger people under 45 are having colon cancer. So that why, we don't know, although some think that diet has a lot to do with it and other factors. But it is a matter of record that people under 50 are having more colon cancer. And it is often the leading cause of death from cancer for patients who are under 50. So just sharing that too. So if you have relatives or friends who are younger than 50 who have a change in bowel habits or rectal bleeding or diarrhea or abdominal pain, then they need to think twice about having a colonoscopy or being evaluated by their doctor. Any comments or questions about that information, which I thought is
Dr.
important
Callender,
to share?
I think smoking and alcohol use make you more at high risk as well as family history.
Thank you for sharing. Any other comments or questions? Catherine.
I was just gonna say my doctor recommended to have colonoscopy, and I was at that 10-year mark. But the insurance or the colon doctor or someone, I don't know if it was insurance related or whatever, but they would not do it. So I was really kind of shocked because I thought you were supposed to have it every 10 years,
That is correct.
Mm-hmm.
but they would not do it. So I did, and I have a history in the family. So I was kind of shocked. I don't know when I go this time, I'm going to ask about it again. But
Right.
the the colon doctor would not, you know, give me an appointment for one.
Time for a new
Well,
doctor.
you made it needed to get a second opinion.
Yeah, I think so.
Yeah, because if the reason is finances, then that needs to be explored because after 10 years is the
It
time.
shouldn't have, yeah, it shouldn't have been that because I have Medicare, but I also kept my employer insurance because I
Yeah,
was a
well,
federal employee. So I kept my insurance.
after you see your doctor, you might need to get a second opinion. Darryl, you had a comment?
Yeah, I just want to give a plug for colonoscopies without sedation because it's safe, effective, commonly practiced, especially outside the United States. In the United States, they encourage you to get sedation, but if you do it without sedation, you can remain awake, skip recovery time, and drive your cells home immediately. So there's a lot of advantages to doing it without sedation.
What are the advantages from your perspective?
Well, okay, anesthetic going under, I always get constipated. Then it's the hassle of having somebody, you have to have somebody drive you to the colonoscopy and come back and drive you back home. I've had it both ways, and it's only minimally uncomfortable. So I don't see any advantage to having it under sedation.
I love that sleep though, Darryl. When they give you that, I can see why Michael Jackson got so addicted to that.
Okay, well, it's different strokes for different folks. Okay, Janice, comment?
Yeah. Darryl, without sedation, is it a full colonoscopy?
Yeah,
To me, it would
Yes.
be very uncomfortable. It sounds like a
it can be.
flexoscope or something.
No, it is not uncomfortable. It's only
That's not true.
mildly.
For some people, it is. For some
Mm,
people, it is.
Okay.
yeah.
For me, it
Maybe
was
for you,
only
it
mild.
wasn't.
You just felt the probe going up, but it was just
Oh,
only
no.
mildly
Well, it
uncomfortable.
depends. I've done
Yeah.
it myself,
You're stronger than
and
I am.
it varies from person to person.
Yeah.
Yeah.
Darryl, one question. What if you have a polyp that needs to get removed? Would that increase the discomfort?
Probably not, but
Okay.
there are other factors that are involved in terms of the anatomy of your colon.
Mm-hmm.
Right. Yeah. For some people, it's uncomfortable. Betty Blair?
Yes.
Mhm.
I have had a colonoscopy without sedation. I'm thinking that it was probably my first, maybe the second one I ever had. But they did ask me to have someone pick me up. They didn't, so I guess they were saying I needed to have someone bring me and pick me up, but they did say I needed to have someone pick me up afterwards. But it was not uncomfortable. I watched the screen as they were doing it, and it was really quite fascinating to me. And actually, the next time I went to have a colonoscopy, I wanted to have it without sedation, but the doctor said no, they sedate. So I guess it went away after so many years. But I was very comfortable having it without the sedation.
Thank you for sharing. Joyce?
My husband had his done once without being sedated. The next year, he asked me to take him for his examination. I think he found it to be a little bit uncomfortable for him.
Yeah, it varies from person to person. Yeah. Depending upon your anatomy and the ability of the colon to dilate as you push um, uh, the colonoscope uh, all around, because you go throughout the entire colon, and sometimes the anatomy is not as easy to move the scope as it is for others. So it varies. Okay, so I think that that was the important thing. The next article was an article about should you take a supplement for heart health? And I think after all was said and done, it was felt that a supplement for heart health is not a good idea. That there are many uh, good things you can do with your exercise and diet that will uh, keep your heart healthy, but taking supplements was not going to be protective for your heart. So that was an interesting article. And then finally, there was an article that says if you have a lot of difficult people around you, that it increases your stress, which shortens your lifespan. So that you should spend your life around people who make life easy for you rather than making it stressful. It's almost like uh, we're being black, so we have more stress. So we're likely to live shorter lives unless you adopt healthy lifestyle changes that we've been talking about at every meeting. Dr. Perez.
There's a West Indian song. If you want to be happy for the rest of your life, never make a pretty woman your wife. Talking from a personal point of view, get an ugly woman to marry you.
Oh, well, to each his own. Okay, any other comment on staying away from difficult people? Didn't say anything about being pretty or ugly. It says people difficult to get along with. Yeah. So that was what they are saying to you, that that if you want to live a longer life, stay around happy people.
Easier said than done, Dr. Callender.
Yes, of course, absolutely. Carol?
I think it's quite true. We had another article. When you're around stressful people, people that you know that have mental problems, as my son says, if you see someone crazy, run. But stressful people do present stress upon you, and you should surround yourself with people that are happy and upgoing. If you know someone is always negative and etc., don't be around them. If you know someone, you just see them and you're allergic to them because of their personality, don't associate with them. Just be nice, considerate, but don't surround yourself with negativity. It causes mental and physical uh, injury upon yourself. You be starting becoming evil and irritable with them. So that's one of the best antidotes about it. And I think we discussed it before. That's why I love this group because everyone is so beautiful and you're not stressful to me. So I can smile.
Okay, thank you. Thank you for sharing. Okay, John, why don't you start with the articles? Bed bug nightmare. This is an interesting article that talks about the fact that in southern states, interesting how it identifies southern states uh, have a bed bug problem, and they link most of this to traveling in places that are accommodations are budget friendly is the term they use. And the budget friendly places have more bed bugs. And they say young people and students who want to go to the cheapest place possible are likely to go to places that have bed bugs in them. And they talk about where they are located, as you can see here. And they also talk about what they recommend you do if you think that your clothes are infected or infested with bed bugs, because it says that place your clothes in a dryer and high heat for 30 to 45 minutes if exposure is suspected. Uh, Carol, you had a comment.
That applies to, I know when John and I had our 25th anniversary and we went to an island and we had a child or two in college. So we went in an economical hotel and we turned off the lights and that's when the roaches came out. So it's, I couldn't sleep that whole vacation. But, you know, bed bugs and service and sometimes even expensive hotels have bed bugs. So you have to be extremely careful. And I have a lot of friends, and you know, they go to a hotel, they just spray the whole thing down and still take that precaution.
Thank you for sharing. Any other comments as you travel? Keep us in mind. It's interesting they identified that the southern states were the ones that were the more commonly involved. But Janice?
As I mentioned earlier, Kayla is graduating this year, in a few months. And of course, Chris wants everyone to go. I'm not familiar with Airbnbs. I know that's very common now. And I just see it as staying in someone's house. And I have reservations. And I said, Chris, I don't know about that. And I'm thinking bed bugs, whatever. And I said, okay, maybe I could take my own sheets, but do I sit on the furniture? Help me out. Is it just that common? Is it like a hotel? Um,
I
I'm
don't think it'd be
comfortable with
any
that.
different than a hotel, really. I don't think it'd be any different.
Really? Um, of course, I'm going.
Probably less turnover than a hotel.
I don't know. I'm taking care of everything. I'm doing this, I'm doing that. He's got people coming and but I just see it as being someone's home. But I guess I'll find out. It's a new experience.
Congratulations on the new experience. That's exciting. Darryl, you had a comment?
Yeah, I've done Airbnb several times, and it's always been good experiences.
Mm-hmm.
But you have a lot of reviews. I read the reviews, and they're very honest. I only go for the places that have a lot of reviews and positive reviews, and that's
Okay.
why I have a good
Good idea.
experience.
I'll do that.
Yeah. Yeah, my wife was like that. I liked budget friendly places, but my wife didn't. If they didn't meet Daryl's criteria, then we couldn't go there. So anyway, Joyce, you had a comment?
Yes, when we went to Disney last year, we stayed at a townhouse that was an Airbnb, and it was very, very nice, very clean, very, very accommodating, and very spacious. And we also checked out the reviews before we booked the place, but
Mhm.
it was quite a good, pleasant experience.
I'll do that. I'll check the reviews.
Carol?
We went to an Airbnb to Florida also, and the children enjoyed that better than Disneyland, Disney World, Legoland, and all of that kind. In fact, they wanted to go back to the home and stay the whole time, and you would think we'd spend all that money. But then Darryl also arranged for us an Airbnb when he went to Indiana, and it was really, really nice. It was family gathering, and the home was exceptionally very clean, cleaner than I think of hotels. So like, and he checked out the review. So I don't know how he did it, but it was a fantastic experience.
Okay, thank you for sharing. Okay, I guess we can go to the next article. The one vegetable the cardiologist recommends, avocados. That's the one that is the delight of most cardiologists. And I think that's almost unanimous among cardiologists that avocados is thought to be the best. Although many of the fruits and vegetables that we eat are on the list as well. But if there was one that they invariably recommend, it's avocado. How many of you like avocados? Yeah, it's probably thought to be the best vegetable, although there are others, but that is the one that most of the cardiologists would recommend almost unanimously. John Buchanan?
Yeah, I eat at least 2 avocados every week. I make guacamole and I have nachos and stuff like that with it, but which maybe are not that healthy, but I really like them. I like avocados. I've had them just sliced um, with eggs. That also works. So yeah, I'm a big fan of avocados. I like them.
Okay, thank you for sharing. Any other comments? If not, it's amazing that I remember John Robinson, our psychologist who worked with us, was another fan of avocado, although they talk about guacamole as well. But invariably, avocado is the top one. Yeah. Any other comments about this article? Oh. Have you had it in smoothies as well?
Not.
Anybody have it in smoothies? Okay. Catherine?
I was going to say, I have recently found you can buy frozen ones. I believe it was at Costco, cubed frozen ones. So you can just have a few, chunks of it to put in something periodically without actually, I don't know if it's better to have I'm sure it's better to have the fresh ones, but I have found that on the frozen shelf near the fruits, the frozen fruits.
Thank you for sharing. Sylvia? Sylvia? Oh.
All right. I'm sorry. I was on mute. I just stopped driving. I said I love avocados. I normally have like avocado toast. You can buy the little smaller containers, and I put it in smoothies. You can buy fresh avocado and you put it in the freezer so you can put it in your smoothies. and guacamole. So it's delicious. I don't know what's wrong with y'all. But it
Okay.
tastes good. You have to season it, because it doesn't have really flavor to it, almost like I think tofu, they say. But you can season avocado with when you make your guacamole or put some seasoning in it, it'll taste delicious. Crackers or tortilla chips, and it's just good eats.
Okay. Thank you for sharing. Um, let's go to the next. Oh, John, you had something else to say?
One more thing. I'm really surprised when I prepare guacamole with my avocados, how greasy they are. It's almost like they have a lot of oil. And now I've seen avocado oil that you can cook with as well. So I don't know, maybe Darryl might know something about that, but it's surprising. I really have to wash my hands because it's so oily. And I think that's probably one of the benefits of avocado is that it helps your system with the oils.
I
Thanks.
think it's the omega-3 oils.
That's it.
Uh,
We use
John, you
the
had a comment?
avocado oil like olive oil.
Darryl, you had a comment?
Yeah, John asked about avocado oil. I cook with it. It's, I prefer it to the seed oils. They say it's
Okay.
healthier than the seed oils.
Thank you for sharing. Okay, let's go to the next article then. These 5 foods may raise your risk of oral cancer, according to experts. And this is uh, not surprising. Processed meats, alcohol, red meats, sugar sweetened beverages, and fried foods increase cancer risk. High heat cooking, deep frying, and charring is well known to damage the DNA and release carcinogens. And then they're suggesting that use baked chicken instead of the high temperatured meats. Tobacco use, of course, and another article talking about the importance of HPV vaccination because we know that there's a risk association between HPV and oropharyngeal and genital cancer, anal cancer. Carol?
I was wondering when I go into my doctor's office and they have one of those old dietary charts where they have bologna and etc. Should I tell him that is no longer the chart and he should buy a new chart? Because I thought all doctors knew that processed meats were really bad for you. But I still see bologna and all that kind of stuff on his little meat process, meat, vegetables, starch, and everything.
Well, you know the truth, so the truth shall set you free.
So I should go in there and tell my doctor take that little poster off his wall.
Well, I can't tell you what to tell your doctor, but you know the truth, so the truth shall set you free.
Oh, do the hospitals know this?
Everybody knows it.
Okay, because they still, I don't know. People that have been in the hospital, don't they still sometimes give you processed meat when they serve you meals?
Yeah, they do. They still serve. Yeah, they still serve it. Uh, uh, they still serve stuff that is good for you and stuff that is not good for you.
Yeah, and so why do another factor? Why they give us ginger ale and everything? That's a soda, and sodas are bad for you, or ginger ale is better for you, or why do they give you? You sitting in the waiting room or emergency
Well,
room, they'll say give you ginger ale and crackers.
well, they kind of give you what you want to eat, so you make a choice.
Well, that's all they
Uh,
got to offer is ginger ale or water.
well, I can't speak for the hospital, so,
Okay.
but I think you know what's good for you and what isn't. So one of the things that is impressive is that uh, churches, like hospitals, they except churches almost always have unhealthy food, whereas hospitals, there you have a choice. But most of the church's efforts uh, flourish with unhealthy choices. And this talks about the fried foods, particularly as an issue. And they talk about why you have more cancer in young people. As Darryl has said many times, a lot of it relates to what you put into your body. Any comments on all of these articles that are saying the things that we talk about every week, and which may explain why you have more colon cancer in younger people? Carol?
Um, this air fryer, I know they say that's better. That's because of lack of grease. So you can still have your fried foods, only except it's air fried.
What is your question about air frying?
Um, you still can have fried foods as long as it's air fried rather than
Well, it's
grease
because air
fried.
frying involves high temperature cooking, which still form. However, its cooking time is shorter, so they think it's less uh, less harmful than the other fried foods. So they say it's not entirely risk-free, but it's better than the other fried. Any other comments about what's safe and what's not safe? It's interesting because when you see people barbecuing things, and you see a lot of it black, and you realize how that's impacting the DNA and how that can become carcinogenic. Dr. Perez?
Now that I'm a nana, I can see, Lennox wants to eat what he sees us eating. And it becomes, you talk about the barbecues as we're getting ready to go into the holidays and the kind of things that bring us together. We
Yeah.
have to become far more creative because, you know, um, we used to have some good times in Sag Harbor, roasting the pig in the back of the yard and, the old men sipping all night and, their habits that were cultural that weren't so good for us.
Yeah. Yep. So true. Thanks for sharing, Betty.
Yes, I'm like Dr. Perez. We used to things we used to do and are used to from growing up. We really do need to change our habits. And I know I can't even remember now how many years it's been since I really stopped frying. I do more baking than frying. Every once in a blue moon, I might fry a pork chop, or my husband will say, I got a taste for fried chicken. I might fry, but most of the time I'm using my oven and I just bake as opposed to frying. And actually, I'm kind of getting away from meats, which is probably a good thing.
Thank you for sharing. Okay, well, let's go to the next one. This is an interesting article about uh, common kitchen mistakes can increase exposure to cancer-causing chemicals, and they emphasize a nutrient-rich diet, but they also talk about reusing cooking oils and how this high temperature and repeated high temperatures causes DNA induced carcinogens, which may be part of the reason why we have more cancer than ever before. And so they're emphasizing the high temperatures for oils and being part of the reason fried foods are dangerous. Any way you look at it, it's what we're putting into our bodies that is making us more likely to have cancer at younger ages and at older ages. They emphasize in this article the use of the extra virgin olive oil and avocado oil that Darryl talked about. Uh, John Buchanan?
Yeah, I was wondering how many people reuse the oil after they use it, you know? I think that's one of the points they're trying to make. Don't reheat oil after you use it. I'm not familiar with that.
I'm not either. Darryl, you had a
I
comment?
Well, when I grew up, we had all kind of oil in a coffee can,
Right.
and it was bacon grease, it was
Hmm.
lard, it was Crisco, it was
Hmm.
vegetable oil, and but there was a limit on that. Usually,
Hmm.
it started tasting nasty about the third or fourth time you reused it. Reality is it's a wonder we're still alive after eating all that reused grease.
Yeah, that's
That
right.
was during our parents' generations. I guess there's some that will still do it. Maybe economically it might be feasible, but I remember my mother did it. Yeah.
Sylvia?
Yes, my mom still does it. And I think I remember seeing on one of the YouTube universities, they were talking about take your oil and add cornstarch to it and let the cornstarch absorb all of the crumbs and things at the bottom of the oil that will bring the oil back to being clear. And you can use it again.
Mhm.
But yeah, we do reuse our oil. I don't reuse fish grease oil,
Mhm.
but I have reused oil, and my mom currently does also. And
Mhm.
I guess she's 94,
Mhm.
and
She
she's
not
still
changing.
alive and kicking.
She not changing. She not changing.
Yeah, it's amazing what our bodies can stand.
Yeah.
Okay. Carol?
um yes, people still do it. I saw an advertisement on Facebook and TikTok where they got a can where you can actually strain the grease and use it again. I didn't know people were still doing it. Like Darryl said, I remember my mother did it all the time. And some people do it, even seasoning greens or anything. It's supposed to have been the best seasoning oil there was because it had that seasoning taste to it. But I didn't know people were still doing it until I saw that advertisement that they had this silver can, which I remember, with a
Mhm.
little strainer on top to get the other, when you fry food, the leftover stuff. And they're actually selling it. And it was at Bed and Bath and Beyond.
Mhm.
Okay, thanks for sharing. John Buchanan, you had a comment?
Yes, one of uh, the habits that I grew up with. My grandmother used to have a grease container next to the stove, and after you cook the bacon or the sausage and whatever, you put the grease in this container. Now Actually, that's much better for the environment. You don't want to put that grease and oil down the drain. So what I've been told by an environmentalist is that you take that grease and freeze it, and that breaks it down. And then you take that frozen grease and put it in the trash. They said never put oil in the drain. Never put oil or grease down the drain because it'll mess up the ocean. Thanks.
Thank you for sharing. Betty?
Yes. Not only will it mess up the ocean, it'll mess up your pocketbooks because you'll clog your pipes and you'll have to spend money to get them unclogged. So my grandchildren clogged up my drains, pouring their grease down, and it cost me $400 to get them unclogged. So there's nothing wrong with having the can or the whatever to catch it, but just like John said, once you get it in a jar or a can, then put it in the trash. Freeze it and put it in the trash, not down your drain.
Thank you for sharing. Thank you for sharing.
Important to freeze it first.
Yeah, freeze it. Freeze it. Yeah.
Okay, any other comments? If not, we'll go to the next article. Well, this is an interesting article that tries to say that the super agers' cognitive longevity is because you got more brain cells. And they looked at the hippocampus and they found that these super agers had more networks. And this was the reason why they're so exceptional. This was published recently in Nature, and it's interesting how they actually. Of course, the only problem with this is that they do this afterwards. You know, not they only do this afterwards, so they only know this based upon postmortem evaluations. So. And comparing them to the so-called normal aging people.
Dr. Callender, after helping my father out for the last 2 years, and he'll be 103 in June and is still living independently in his own house, I think it's stubbornness more than intellect.
Listen, there's a whole lot of people who are stubborn, but not a whole lot of people who are 94. So it's more than that. Yeah. There's a lot more stubborn people who are in the grave.
Yeah.
Well, anyway, it's we study why people who are super agers, and we keep trying to find ways to live longer. And the question is, how much longer can we live? And some people think that the ultimate is about 150, but what kind of quality of life do you have at 120?
Yeah.
Anyway, but we're still. Ponce de Leon was looking for the fountain of youth, and we're still looking.
GLP-1s.
Any other comments? If not, we go to this is an article that talks about the GI problems associated with use of GLP-1s, and one of the side effects is constipation, another is diarrhea. But it also talks about how to handle the constipation as well as the obstipation and the different strategies to address uh, the constipation that is a side effect of GLP-1s.
Yeah.
And I think this is one of the few articles that I've read recently that actually talks about the constipation and how to handle it. Because one of the things that I think with older patients and people, they have more constipation and obstipation than you might realize. And so understanding this and a lot of this, as Darryl has mentioned many times, is related to what you put into your stomach uh, and the fiber or lack of fiber that you put in your body, and whether or not you drink enough water and those kind of things. But this article talks to a great extent about the ways to handle that. Darryl?
Yeah, just coming back around to our earlier article, avocados are great for dealing with constipation. They're high fiber, they help soften stool.
Right. And just like um, John was talking about earlier, his berries and all of those are also uh, fibers as well as the prebiotics and probiotics that help as well. Dr. Perez.
This is a question. Given the skin on avocados, is it necessary that they be organic?
I wouldn't think so.
You asking me?
Yeah.
Well, you see, I know that, let's see, you compare it to a banana. A banana has a little thicker skin. I only buy organic bananas. They say that conventional bananas, because of their thick skin, is safer, but not as safe. Some of the pesticides still do penetrate. Um, Organic avocados, they have a little bit of a thick skin, but it's not rhinoceros skin. So it's a question I can't answer because I never eat conventional fruit or vegetables. I always only eat organic.
That's an answer.
Mhm.
Any other comments about the article? If not, we'll go to the next one. This is an article about alcohol. In light of the new dietary guidelines that are emphasizing the toxic role of alcohol in kidney disease, as well as many other diseases, uh, the counseling of people who are alcoholics becomes a critical issue because if they continue to drink much of the advantages that they will get from uh, adopting healthy lifestyles will be compromised. And so this then makes it a very confounding issue. So the more that we learn about alcohol, the less we recommend it, uh, drinking it. Although the good book says a little bit is good for the stomach's sake. More and more studies are demonstrating that alcohol, uh, when you take more than one glass a day, causes many problems, as you see in this article and others, whether it's hypertension or liver disease or kidney disease. Any comments about this? And anybody who thinks that that alcohol is good for you? because I know growing up, a lot of people thought alcohol was good for you. The more we learn about alcohol, the less we find that it's of value. That first?
It's popular culture. I think a scandal and, how sophisticated and with it you looked with your red wine like Kerry Washington, and had situations handled. It's interesting how we can be deceived.
Yeah, just like with cigarettes. Yeah. Carol?
In the Baptist denomination, one of the cardinal sins, it wasn't not loving God, it was being a drunkard, drinking. And they even built it into their covenant, abstain from the sale and use of intoxicating drink. That was right up there with going to clubs. So a lot of religious organizations, even the Pentecostal, drinking was one of those deadly sins that you should be against. And if you look at United States in the 20s and 30s of prohibition, they were trying to outlaw, stamp out anybody drinking alcohol. So that was a craze in the United States for a while. Then they finally allowed it. But as far as religious, certain religious, not the Catholics, and so that's why I love taking their communion, but the Baptists, they'll have it, but no alcohol in there because that's one of those things that you just can't take.
They used to say that that's the priest's disease because they are constantly taking communion with alcohol.
Well, I like the priest disease.
Yeah, they even have the Christian Brothers wines, and oh man, I stayed when I was in college. I stayed at a place where the Christian Brothers were in charge, and this is I was just in college, so a lot of drinking going on. But those guys drunk me under the table. I had to leave. They were still up drinking. I tell you, it was crazy, crazy.
They have to know you went to Notre Dame. Okay,
Yeah.
Catholic. That's why he was talking about the priest disease. Catholic, I love their communion. They got the real wine.
Darryl, did you have a comment or you changed your mind?
Yeah, I changed my mind because I was going to say that the only food or drink that's approved for religion is the avocado because it's holy guacamole.
Thank you for sharing that, Darryl. Okay, let's go to the next article. Here again, the GLP-1s, the concern about alcohol consumption with GLP-1s because the two together just don't mix. And so if you have a patient on GLP-1, they're supposed to be advised about decreasing or eliminating alcohol, particularly because of its impact upon kidney health. And as you've underlined, the fact that you're more likely to be inebriated at different levels. So this is just another issue in which alcohol consumption is a health issue, particularly with GLP-1s and its impact upon kidney health. And it talks about what kind of alcohol you drink, whether you drink vodka or beer and so forth and so on. Um, since GLP-1 drugs are taking over, um, we're learning more and more about its side effects, and the alcohol consumption is just one of the other
Attention
things.
adults over 60. Your Social Security increase will not be.
John Buchanan?
Yes, I was just thinking about the TV when I watch the football or the hockey games, baseball. Every other commercial has guys drinking.
Yeah.
Uh, it's a big deal. Well, even though I've noticed they can't show you actually drinking. You know, the bottle or the can or the glass goes right up to your lips. They cannot broadcast you. I mean, you can see it in a movie, but on the commercials, you can't show actual drinking. But it seems like every other commercial is about alcohol, and
Yep.
the other commercials are about drugs for different things. It's really our society is so focused on changing, changing who you are by chemistry. Thanks.
Yeah, it's but one of the things that hasn't changed is that you still have a alcohol store in every other block. So no matter what we try to pretend, alcohol is still consumed to an inordinate degree. Do you have more alcohol stores than churches, or which is number one? Used to be churches, but I don't know anymore. Now, this is another article that talks about colorectal cancer being kind of increased, but when push came to shove, the data was not very convincing that GLP was associated with colon cancer, although there was a slight looking at meta-analysis, which means you look at a lot of different studies together and try to identify a cancer risk. I think uh, I was not that impressed that GLP-1s are associated with colorectal cancer increase, although it'll take much more than what they have here to convince me that this is really true. But I think with time, as we use more GLP-1 drugs and we learn more and more about the side effects, we'll be able to answer this question. Right now, the data is unclear. But it's an issue that they raise nonetheless. So we'll have to wait and see what time tells us as we have more and more experience with GLP-1 drugs. But this suggested there may be some paradox there, but I wasn't really impressed. Let's go to the next article. This is an article that talks about the fact that when you stop taking GLP, do you regain all the weight that you lost? And this article suggests that after you stop the GLPs, you regain up to 75% of what you lost, uh, and 25% in a year, which is not completely In other words, you don't regain all, but 25%. So
Dr.
because
Callender, it just seems like there's a lot of data coming out now with the GLPs, and certainly they've helped a lot of people lose a lot of weight, and that's good. But you have to stay on these medicines forever to maintain that weight. And is there any real long-term data on, the effects that they have over, 5, 10 years?
that's the problem, and that's what we're accumulating now.
Yeah.
Uh,
It doesn't
is
sound like it's so good, though.
well, as long as you take them, it's good.
Yeah.
When you stop taking them, then there's a bounce back, which is
Yep. Yep.
it's so it's and I think it's going to take time before we really get the total answer to the question that you raised. Uh, but uh, uh, but time is coming because I think we started using these drugs in the 2000s,
Yep.
and as we get closer to 2030, we'll have more data. But those who have had bariatric surgery, uh, they have evidence that there's a long-lasting effect of the bariatric surgery, whereas the GLP-1 drugs, once you stop using them, the regain is uh,
Hmm.
is an issue. Yeah. Any 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 other comments about this article? As we wait and see what really is the situation.
Yeah.
Next article. This is kind of a game they play in which they talk about the fact that we've seen a lot of studies that demonstrate exercise reduces depression. So they're saying, why don't we get medications that reproduce the same things that exercise does, and then maybe we don't need to exercise. We just give them the medications, and that will help depression, which is to me insane. But anyway, that's what this article is all about, saying that the omega fatty acids and those other things that occur as a consequence of exercise, let's just give them those things and forget about the exercise. And I think but that figures that we would want to do something like that instead of doing the real thing that really works and we know works. So why would you need to have mimetics when you can exercise? But anyway, that's what this article is about. So yeah, let's go to the next article. I think this will be the last one. It's, no, my clock is wrong anyway.
Yeah, I couldn't grab more of this article. Uh, it was cut off. So I
This
don't
is
know
the
if
one
you
about
want.
AI.
Yes.
Yeah. Well, AI is going to be incorporated into almost everything these days. And I think one of the important things about AI is that it is a tool that can be helpful. And I think as long as it's used in conjunction with other things, I think there's a great role for it. But using it alone is not what's going to be not going to work. But I think using it in conjunction with the pathologist, with the hematologist, with the radiologist, with the other healthcare providers. It's going to be a wonderful thing as long as we also make sure that the same bias that we put into everything else is not incorporated into AI, which is likely to be the case, especially since the administration we have now is trying to eliminate getting information on uh, different ethnic groups. And soon we won't even know uh, what disparities are because we won't have data on different ethnic groups. But let's go to the next article if there's one. This is an interesting article that says that a lot of the childhood obesity could be related to parent stress. That's an interesting conception, and they have data to show that if the parents underwent mindfulness training, that they had less childhood obesity, saying that a lot of the stress occurred from the parents. Well, this is one group identifying this as an issue. Dr. Perez?
I know that was the hypothesis when I did my fellowship in adolescent medicine, that they're females whose mothers had stress during the time that their daughters were in adolescence had a higher percentage of overweight and obesity. And that was in a New York City population. And it's spread out to then their sexual practices at the time. And the caveat was where we were with HIV disease at the. So it does have a significant impact. What we're thinking about and how we relate. And I think the last couple of articles that we have had, that we've discussed, speak to the importance of memory and behavior associated with AI that does not have that particular ability, such that you could even question whether it would be better to give chemicals that are normally released in exercise as opposed to actually exercising. So
Yeah.
there are many things that we know are absolutely ludicrous because we have lived through it. That young people, don't even appreciate. Prayerfully this evening, I'm going to see a movie on how we got to Medicare and Medicaid and what impact that had on integration and equity. And that's a historical component that is critical going into these midterm elections.
Well, since we're eliminating Medicare and Medicaid for many populations, we shall see what's going to happen. Since there's been no ability to restore the Medicaid and Medicare that the current administration has eliminated.
I know a story, if and this is in South Carolina, someone who is in his early 70s said that his twin sisters in South Carolina, in transport of Black people, okay, before Brown versus the Board of Education with integration, when they transported Black people, they tended to be transported from either a doctor's office or home to a clinic or a hospital via a hearse, not an ambulance.
Hmm. Interesting. Hmm. Well,
We cannot go back.
we well, our administration has a different perspective, so that's why we need to change administrations because they have a very different perspective. Well, this is an article that suggests that our antibiotic use is causing Crohn's disease and uh, other inflammatory bowel diseases. And whether this is an association or not, the data suggests that our exposure of children to antibiotics may be one of the reasons why we have more inflammatory bowel disease. And this is, I think, the most important aspect of it is to be sure if you want to use antibiotics in children, that there's a reason for it. And so if there's a reason for it and the risk is great, and this is the consequence, then I guess there's not much you can do about it. But if the antibiotics are not necessary in the first place, then it's dangerous. And this association, uh, Dr. Perez, did you find any of this in your practice?
Yes, quite a bit at then LIJ. And I think it really speaks to why it's so critical now that we vaccinate. So during the period of time that children are not given prophylactic coverage with antibiotics before a viral syndrome can be eliminated. So, it is bowel disease and preemies was basically the bread and butter of pediatrics.
Mm. Well, have we changed now that we know this? Are we
It
using?
depends on I believe that it depends on our continuity of access to care. And when you are only treating in an urgent environment where you don't expect to see or be able to follow the patient, often antibiotics are given indiscriminately. And I
Which,
think the risk then becomes much higher.
yeah.
So, for fear that you won't see the patient again, you prophylactically treat with antibiotics.
Mm. And this is the price we pay. Yeah. Okay. I think this is the last article. So uh, thank you for being with us. I've had a lot of interesting discussions. Uh, and any announcements before as we get closer to the Easter season? Carol, are you guys doing anything special for Easter? Can't hear you.
You're on mute, Carol.
I'm just playing for two churches on that day, but that's it. Are you singing?
No, we're not doing anything special. Well, we're doing something different, but nothing.